Probably good morning wherever you're watching from. Yeah, you're welcome back to Joen Academy. So this afternoon we are going to be talking briefly on hypertension. Okay, so we're going to be talking briefly on hypertension. So hypertension is basically, you know, a condition whereby the force that the blood exerts on the walls of the blood vessels is very high. Okay, it's just a condition, a medical condition in which the pressure or the force that the blood flowing through the blood vessels exerting on the walls of the blood vessels is very high. Okay, so hypertension can be classified. There are so many types of hypertension. There are actually like 10 of them. Okay, so we have the primary hypertension, we have the secondary hypertension, we also have malignant hypertension, and we have also white coat hypertension, and there is a preeclampsia hypertension, and we also have a postpartum hypertension, and we also have hypertension. Okay, these are the different classes of hypertension, and we're going to be taking them one after the other. All right. So, firstly, what is the normal range of the blood pressure? Okay, for an individual that is normal, the blood pressure of an individual that is normal should be about 120 to about 120 over 80 millimeter mercury. Okay, so it should be about 120 over 80 millimeter mercury. So 120 is what we call the diastolic blood pressure. Oh, the systolic blood pressure, sorry. Then 80 is the diastolic blood pressure. The systolic blood pressure is just the pressure when the heart contracts, okay? Then the diastolic is when what? The heart relaxes, okay? In a situation when the blood pressure is about 140 over 90, that is when we say that the individual is hypertensive, okay? And when the blood pressure increases to about 180 over 120, that is a very severe hypertension, okay? And the individual will have to be what? The individual will have to be hospitalized, okay, in this case. So let's take the different types of hypertension one after the other. We made mention of primary hypertension, okay? Primary hypertension is just the hypertension that doesn't really have any disease cause, like it is not caused by any disease, okay? It's just a hypertension that sets in as the individual gets older, okay? So we see it in older people. We see this kind of hypertension in older people. So the other type of hypertension that we made mention also is the secondary hypertension. Hypertension is a kind of hypertension that is as a result of a disease condition or as a result of the kind of medication that this individual is taking. All right. For instance, individual that exposes themselves to contraceptives, okay, um, contraceptives and painkillers tends to be a kind of what? Hypertensive. Okay. So such hypertension is known as what? Secondary hypertension. We also have resistant hypertension. It's just a kind of hypertension that is very difficult to manage. Okay, so we have malignant hypertension too. Malignant hypertension is just the kind of hypertension. It's a severe hypertension, by the way. So is in this kind of hypertension, the organs, important organs of the body can be damaged. You understand? So important organs of the body can be damaged in this kind of hypertension. For white coat hypertension, this is a very funny and type of hypertension. Why I say this very funny is because imagine a situation whereby the blood pressure of an individual tends to increase when the person is in a clinical environment. Okay, for instance, when a patient visits the hospital, the person tends to be a kind of hypertensive, the blood pressure of the person tends to increase, we call it the white coat hypertension. So the other type of hypertension that is a kind of opposite of the white coat hypertension, when the person is when the person is at home, the blood pressure tends to increase. Okay, if the person is in clinical environment, the blood pressure tends to decrease. We call it the maxed hypertension. Okay, so that is what we call that type of hypertension. Then for preeclampsia hypertension, preeclampsia hypertension is a hypertension that is seen in pregnant women. Okay, this kind of hypertension can cause maternal death. Okay, it can bring about maternal death. Not only that, it can bring about maternal death, it can also cause a fatal defect. Okay, the fetus or the baby can, have some defect when being put to bed. Okay, another type of hypertension is the postpartum hypertension. Yeah, postpartum hypertension is just the kind of hypertension that we see, or that that we see in a woman that just put to bed. Okay, between the 3 to 6 days of giving birth, this woman, or this particular woman that just put to bed, seems to have the blood pressure skyrocketed. Okay, so that's the kind of hypertension. That is what um, postpartum hypertension. We also made mention of asthma hypertension, just hypertension that is as a result of asthma. Okay, so these are the different types of hypertension. Now, does hypertension have symptoms? The answer is no, it doesn't really have any symptoms. So the best way to know if you are hypertensive is by us always checking your blood pressure. So how do you check your blood pressure? You check your blood pressure through the aid of an instrument known as the sphygmomanometer. Okay, the sphygmomanometer. It is the instrument that is used to check the blood pressure of a patient. Okay, we call it sphygmomanometer. We have a mercury in glass sphygmomanometer. Okay, so that is the instrument used for taking blood pressure, since hypertension doesn't really have any symptom. All right, so the next thing that we're going to talk about is what? Management of this clinical condition. Okay, is something that that needs to be managed. Okay, how can it be managed? It can be managed through the lifestyle of the patient, and also through medication. The lifestyle of the patient, in the sense that if the patient engages in exercise, like daily exercise, exercising very well, the patient will tend not to be prone to hypertension. Okay, also drugs. This is where your medical practitioners come in. If you are hypertensive, or if you have anybody that is hypertensive, the person should visit the doctor. Okay, don't practice self-medication. Okay, you should always visit your doctor. Your doctor will do his diagnosis and then give you your prescription and tell you the kind of drugs that you can take, because there are different kinds of antihypertensive drugs that is out there. Okay, there are some that you will take, you will be having some side effect, maybe due to other medical condition that you are having. Okay, so that is why it's important you visit your doctor for prescription and for diagnosis. Okay, then the the next thing that we're going to talk about here is the causes of hypertension in young people, in young adults. Okay, we believe and we always feel that hypertension is disease that is only common among the aged, right? But it is not always that way. It is not always like that. There are some conditions, there are some factors that can also bring about hypertension in young people, and we're going to look at some of those factors. Okay, one of those factors is what? Obesity. An obese person is very prone to hypertension. Okay, that is the fact, that is the truth. That is, an obese person is very prone to hypertension. Reason being that, there could be accumulation of what? Accumulation of fat deposit on the blood vessel, which is known as what? Atherosclerosis. Okay, it could lead to, it can bring about increase in what? Increase in blood pressure of that individual. Another thing that can bring about hypertension is um, family history. Okay, an individual that has, or the parent suffered hypertension, is most likely to be hypertensive. Because of what? Because this disease or this medical condition is in their family history. You understand? So that is why, if your parent or if your grandparent were once diagnosed of hypertension or were once hypertensive, it is important that you also, shake yourself from time to time. In fact, as an adult, we are supposed to be shaking our blood pressure from time to time, whether you are hypertensive or not, because it doesn't have any symptom. It can come at any time. Okay, maybe as we are growing older, as we are advancing in age, it can set in at any time. So that is why it is important we shake our blood pressure from time to time. Okay, another thing that can bring about hypertension in young people is diet. An individual that consumes a whole lot of salt, abnormal proportion of salt, is tend to be hypertensive. Yeah, the individual is tend to be hypertensive because of what? Consumption of abnormal quantity of salt. Okay, another thing that can cause hypertension is use of tobacco. Whether you smoke it or chew it, tobacco increases blood pressure. Okay, so people that takes tobacco or that smokers are liable to become hypertensive. Okay, then the next thing that causes hypertension is drug usage. Drugs like contraceptives. Okay, contraceptives can bring about increase in hypertension. Okay, so these are some of the things that can bring about hypertension in young people. It is not only this, also the lifestyle of an individual can also cause or can also bring about hypertension. An individual that has a sedentary lifestyle, that doesn't really exercise himself, or exercise, or engage in external activities that will bring about this individual exercising himself properly, tends to be hypertensive. Okay, so excuse me. So this is just what I want to share with us this afternoon. So I hope you people are having fun. I hope you people are fine. So just make sure that you check your blood pressure from time to time. Okay, try and check your blood pressure from time to time, and also visit your doctor for proper diagnosis and proper medication. Yeah, I'll see you next time. Keep living, keep having a wonderful time. Okay, always share this um, channel to your friends, encourage them to subscribe, so that the community will grow more. I want to use the opportunity to appreciate you guys once again. Thank you for making it possible for us to hit 1k subscribers, 1k active subscribers. I think we're about 1.7 now. Yeah, 1.07 or thereabouts now. So it's a huge one, and I'm very grateful for that. So you guys should keep on supporting Joen Academy. More videos will be coming tomorrow, hopefully, and there's a video that will be dropping on femoral triangle. So it's on the process of completion, so it will soon drop. So have a wonderful time. Keep being good to people around you, not just people around you, to anybody that you come across. All right. So have a beautiful time. See you next time. Bye bye. All right.
Are you done speaking yet?
Wait, I'm not done yet. I'm still live.